post-treatment with one tooth bleach and that in place. So we're going to a lot more detail on doing single dart teeth that have had no root canal, and then also what we do if they've had a root canal, how we go inside the tooth, clean out the little pulp chamber, and then use the same material that we use on the outside of the tooth to put it inside the tooth and bleach the teeth that way. So a lot of things kind of on the horizon, but we got to make sure we've done a good exam that does hard and soft tissue. We've checked the occlusion. We've taken radiographs as necessary, diagnosed tooth color and the location, found out about sensitivity because that's one of the side effects of bleaching. Identified all the aesthetic restorations they've got, and then done a smile analysis to look for root exposures and stuff. So that's all part of what you're learning over this freshman year and the sophomore year to get ready for the junior year where you're taking care of patients. Some of the frustrating things I see now is this kind of stuff. You may have seen that in Atlanta or here in Augusta or something like that, where you go through the mall and there's somebody dressed up like a dentist with a chair and a dental light, and they're offering bleaching on patients with the light and all this. And we considered that practicing dentistry without a license. They got all kind of options, and but it went to a trial, and the Federal Trade Commission wanted to know from me, what's the difference between somebody who just goes and buys Crest White strips and does it to themselves versus somebody who goes to a mall bleaching or kiosk bleaching. To me, it was the difference between suicide and assisted suicide. You know, I'm not a fan of either one of them, but somebody else who's dressed up like a dental professional, they give them the illusion of training. They don't have any kind of liability for cancer decay. All these things you're looking about, TMJ, they don't have a way to take radiographs. They don't have to evaluate their smile. If they have some kind of emergency and have an allergic reaction or gag on some kind of impression material, they have no plan for that. So basically, they are treat them as if they were a dentist, but without taking a dental license. They're waiting for post-op pain and stuff like that. So to me, that's financial gain for aesthetics at the expense of patient safety. I didn't necessarily see it that way, but anyway, that's gone to the Supreme Court about whether that's legal to do that or not. And we're, I think they already decided that, well, that's a whole different issue. We get into that. Anyway, then you got to figure out, okay, if I learned all this stuff about bleaching, do I run home and tell my sister or brother or mom or dad, you need to bleach your teeth? You ever been to a high school reunion and somebody come up to you and say, boy, you'd look great if you lost 15 pounds. Or, gee, you'd look good if you cut your hair. You know, you don't feel real good about that person's stuff. So when you tell somebody you'd look great if you bleached your teeth, you just hope they don't look good the way they are now. So you have to be really, really tactful. And how do you let somebody know that they're a good candidate for bleaching their teeth and that they would benefit from them, but not insult them. So that's where people have things like, hey, are you happy with your smile? You know, and they have little brochures and things like that. Some people just put it on a medical history. You know, are you interested in lightening your teeth or changing the color? But the reason we got that in here is because anytime you're fixing to do restorative, you've got to broach this issue. So you have to say, have you ever thought about lightening your teeth? We're fixing to pick the shade of this tooth for this composite. And once we put it in there, it won't change color. It certainly won't get lighter. If anything, it'll get darker. So if you go bleach your teeth then it's not going to match, and you're going to have to pay to have it done over. So again, that's the important part of what we're doing this at this particular time. Other folks want to know, would I look better if I bleach my teeth? And what we find is that people look the best when the whites of their teeth match the whites of their eyes. The next time you go to the bathroom, check out this sclera in your eyes, but when the white on the top and the white on the bottom match, and that's kind of what we give folks as an endpoint. We would like to get this and this, and that gives you a very pleasant look when you're doing that. So here's some people with just discolored teeth. Typically, we do one arch at a time. So in this case, we're doing the maxillary arch, and we're using the mandibular arch as a control. And so basically, what we offer is single arch bleaching treatment, because number one, it gives patients less money to have to invest when they get in there. They may never treat the other arch, but it gives them a comparison or encouragement, which helps with compliance over time. And then there's less chance for side effects because you got less teeth covered and less impact on the occlusion. And you'll be amazed how many people will bleach one arch and not do the other. This is a dentist. I bleached his teeth well over 10 years ago. Here he is 10 years later. He never has gotten around to bleaching his bottom teeth. certainly got the money, certainly got the skill. It just, well, I forget about it, you know. And a lot of people will tell me, Dr. Hayward, why should I bleach my bottom teeth? Nobody sees those, but they see their top teeth. So for dentists that have a one-size-fits-all, that's not going to help you build a practice. But it makes for a nice normal look when it's bleached. It'll be slightly darker at the gingival than it is at the incisal, and that's because there's more dentin toward the gingival than there are at the incisal. It helps folks, most folks over 45 tend to look about 10 years younger when they whiten their teeth. Two things that make you look old are your hands and your teeth. And so on TV, CNN out of Atlanta doesn't let the newscasters point with their fingers because it shows their hands, and they all have to have white teeth because it makes them look younger, more intelligent, and more sexy, and all those other things that they do in there. So you'll find a lot of folks, I mean, I've bleached people's teeth as old as 80 years old because they were running in a marathon at 80 years old, and when he crossed the finish line, he looked like he was old. He sent me a picture of him busting the tape. It's like, I want to bleach my teeth because I look so old in the newspaper thing. So, you know, never underestimate how old or how young people are going to be interested in doing that. And then here's a young one. Can you imagine being 14 or 16 and trying to meet boys? This is a 14-year-old girl and having this ground fluorosis on your teeth. So it does a lot with kids and stuff. Here's one 10 years old. You know, they've had those cute little permanent teeth that work great. Now all of a sudden they got these kind of gopher rabbit teeth and they got funny discoloration from them. So we do a lot of folks in that 10, 11, 12, 13, 14, 18 range to do it there. And then you'll see some people, white areas don't bleach out, but the rest of the tooth gets lighter, so it tends to look better and blend in more. Then here's some that students did in the clinic. This one, they went in, it's had a root canal, so they went inside that canine and bleached it, and then put a white composite on the inside. So they got that in good shape. Dr. Lawson did that. Pipe nicotine stains, when you get into perio and start cleaning teeth, you'll see how hard nicotine stains are. It takes about 2 months to get rid of nicotine stains. But you could actually get somebody totally out of smoking and just have a nice outlook in doing that. Tetracycline stains, that's that antibiotic. It takes anywhere from 1 to 12 months, average of 3 to 4 months, but you can get some very nice outcomes from patients that have tetracycline stained teeth. So we like to think about those. It really has to do with where the color is. If this part is pretty good color, and this is where all the stain is, that has one of the best prognosis to be able to change into something like that. The more the color, discoloration is down the gingiva, the harder it is for bleaching to do something in that. So we tell folks that normal teeth take 3 days to 6 weeks to bleach. Nicotine takes 1 to 3 months, and then tetracycline stained teeth take 1 to 12 months for the average of that. And then the important thing, though, is see that composite doesn't change color when you're bleaching teeth. It actually stands out more, so you've got to identify that. This lady didn't realize that this was a composite on the edge of her tooth, and it's going to look worse when she bleaches her teeth, so she's got to know how much is it going to cost and what is it going to do. And so if somebody just goes down and buy over-the-counter stuff, this is another lady that did that. She had forgotten the dentist had bonded to close that space and to close that space, and that she had a crown over there. So it can mess up your smile rather than make it look better if you go ahead and do that. And then not every composite has to be replaced, but this one blends this in pretty good. But you got to tell them what it might be if you get that done. So that's why we like to have dentists supervised, and we know the side effects and all those things that we can do on that. The exam's going to include all those little areas we talked about that we'll go in greater detail. Single dark teeth have all sorts of options that we have to deal with, so we'll work on that. You're going to look at the color of the eyes, the gummy smile, other restorative things, the defects in harmony, and then we're going to talk about sensitivity issues and what kind of tray design, and then how long they're going to treat. So we're going to, by the time you get through the junior year, we'll have given you all those different details. The ideal is we'd like to do it at night. 2 to 6 weeks is what we tell them. There's always that initial relapse, and the bond strengths are reduced by 50%, and the shade changes. So that's why you got to know to do that in your composite. And then we'll talk about the tray designs. We'll do that in occlusion. Not spend a whole lot of time on that right now. But the main thing I want you to do is make sure that you're looking at composite, and you're probably using enamel shade right now. But the very composite you use comes in a translucent and an opaque. And then there are composites lighter than B1 that match light teeth, and then there's some stark white ones and different modifiers and stuff. So you'll be looking at the different composites, how to do the squint test to see what actually is the best shade, and then decide whether you need an opaque one or a translucent one. And that has to do with whether it's laying on top of the tooth or going in between the tooth. And then some of those white spots and dark areas, we'll use different kind of composites in layers later on to block those out. Just always got to wait 2 weeks after that. So, you know, and I'm not going to go through this in detail because actually I have to go to the clinic, but if it's laying on the facial, then you're going to match it pre-op, and we always cure composites on the tooth to check the shade before we actually pick it. Because all the composites change shade just a little bit after they're cured. And so when you have these light shades on teeth that have been bleached, a little bit of a change can make it look really dark. And so you'll squirt out a little bit, cure a little bit on there, and then see how it's going to do. And then you'll go through all this edge prime and bond stuff that you're doing. And so if it's closing a diastamer, if it's going to be a class 4, then you may wind up needing to use that dentin or opaque shade and do it in kind of layers and stuff. And so you'll get on that, and you'll get into the long bevels and how to use a 12-blade scalpel. And we try not to use friction grip burrs on the facial if you can help it, because you tend to get a little white line. But you're going to deal that more with natural teeth. So I'm glad y'all doing some stuff with natural teeth today. And then you may get some, have to use some tints and things later on. But right now, what you're using is this curved crevice. To see it comes in a body and an opaque. And sometimes on a class 4, you'll use it's the same shade, but you'll use the opaque material or the dent material in here, and then you'll come and cover that up with a translucent incisal, and that'll give you the kind of look. So as you get into clinic, you'll find there's all kind of special shades that are all made by the same company that match this, and you'll be using those different areas to blend in. Because if the patient has a translucent incisal like this, and you put an opaque shade on it, it's going to look incorrect even though the shade is correct. So we have the patient put their finger behind there, and you can see was that translucency, which it was. It wasn't discoloration, so you have to plan in your composite how to take care of that. And then the lighter shades that you use, the room light, especially on a bright room, will set those up quicker. So sometimes we'll protect the area that you're working on after you pick the shade with an orange light, and some people hook it onto their operatory because the composite will set up on it before they get done working with it. And I like to use a 12-blade scalpel. I'm not sure if y'all will use those in here, but you can carve composite just like you carve amalgam with a 12-blade scalpel. So we'll use that to carve the gingival area on, not on plastic teeth, but on enamel. A latch-type round burr will not cut the enamel, but it'll cut the composite. So you can use slow-speed latch-type round burr to be able to find your margins again, and you can use a 12-blade scalpel to be able to carve that inner margin. Here's the kind of typical thing you'll have. The patient comes in, you're going to close that diastema. First thing they do is bleach their teeth. Then you wait 2 weeks. Then you're going to come back and squirt some material out on there, squint to see which one of them disappears first. That's the one that matches the best. And then come back and add that. None of the restorative materials will change color. So, but important about the bond strength, 25 to 50% reduction on composite, and you got to wait 2 weeks. And so bleaching oftentimes makes it when somebody has, can you imagine picking a composite to match that shade? Be very difficult. So, you know, if you lighten the teeth first, then you can come back and pick some better shades and have some better aesthetic outcome. So the typical thing, here's one done in the junior clinic. This lady has an endodontically treated lateral, got facial composite on it that's stained up. So they wound up first going inside the tooth and cleaning it out, and then put some material in there. And then they made a single tooth tray that bleached it from the outside. And then when they got done with that, there's the bleach tooth before and after here, waiting the 2 weeks for it to stabilize, and then they came back and replaced the composite on the front. So that gives them all these little tricks that you're using to start here and go down to here is all about bleaching and bonding. And so that's why this happens at this point of the curriculum, is to get you thinking. It's got to include the whole aesthetic evaluation, because we're doing aesthetic restorations so that the patient's going to look good. So I got to make sure that everything does